Vaginal bleeding during pregnancy can occur on the second and third trimester and also as a postpartum bleeding. So, today we're going to talk about some of the etiologies for vaginal bleeding for the second trimester. And there are three main ones: placenta previa, placenta accreta, which is in a spectrum disorder, and placenta abruption. Placenta previa is when the placenta gets implanted very close to the internal os of the cervix. Placenta accreta is a normal adherence to the uterine wall, and placenta abruption is an hematoma between the placenta and the lining of the endometrius, with consequences for the mother and the baby. The incompetent cervix, which is not a bleeding problem, it is a weakness leading to premature dilation of the cervix with the consequence of a preterm birth. Etiologies for the third trimester are going to be same: placenta previa, placenta abruption, vasa previa. It has to do with the cord, umbilical cord, and cervical bleeding due to cervical changes. With respect to placenta abruption, I already told you it is a premature separation of the normal implant placenta. This occurs after 20 weeks of gestation, but it occurs before the delivery of the infant. It is an emergency. It has to be treated. The hematoma can occur in a marginal separation or a partial separation or a complete separation. While the blood accumulates, it could be self-limit, which means that it does not dissect the placenta attachment further, or it may proceed to a complete abruption. The bleeding, it's usually due to a vascular rupture, and the hematoma accumulates and tracks along the decidua. And this is the pathomechanism separating the placenta from the remaining decidual layer, will cause hypoxia in the baby, but also hypotension in the mother. Placenta previa is the implantation of the placenta over the overlying the internal cervical os. It can occur as a leading cause of bleeding in complicated pregnancies, 4 in 1,000 over 20 weeks, and the incidence is higher in early pregnancy before the development of the lower uterine segment, and this is important. Most of the placenta previas that occur early can be resolved with the progress of the pregnancy, because the placenta can migrate and not be longer placenta previa. The risk factors, apart from advanced maternal age, multiparity, substance abuse like cocaine, smoking, assisted reproductive technology, and previous cesarea or previous placenta previa. The types of placenta previa are going to be low-lying placenta and marginal. The low line is going to be located within 2 to 3.5 centimeters from the internal os. Marginal is going to be more close, 2 centimeters from the internal os. And then we have the partial and the complete placenta previa, which are complete or partially covering the internal os. The consequences are going to be postpartum hemorrhage, and the mortality and the morbidity is going to be for the mother and for the fetus. This placenta previa needs to go into C-section delivery. Postpartum bleeding is an excessive bleeding after a vaginal delivery. It occurs around 5 to 8%. It requires usually transfusion. In the United States, it's the third leading cause of maternal mortality, and it's responsible for over six maternal deaths. Usually, if it's a vaginal delivery, it has to be over 500 ml. And if it's a cesarean delivery over 1000 ml, these numbers can change from book to book. The etiologies, the main one is going to be uterine apony, obstetric laceration, the retain of the placental tissue. That's why we need to make sure that we have all the membranes after the placenta is delivered, and also coagulation effects on the mother, like, for example, von Willebrand. Uterine atony should be diagnosed and treated as soon as possible to stop the bleeding after vaginal delivery. It seems like the anesthetic has something to do with uterine atony. So, third stage of normal labor, we have, remember that third stage of normal labor implicates the separation of the placenta. If you attempt to speed that separation, it will do harm to the mother, and maybe it will cause some of the complications, which one of them is the entrapped of the placenta. We need to inspect the completeness of the placenta and all the membranes and parts of it immediately after the delivery of the placenta. We never should do traction, hard traction over the umbilical cord. Abnormalities of the third stage of labor is when the placenta has separated, but it gets trapped due to a rapid contraction of the lower uterine segment.